Okay, before we begin, are there any questions? I'm not hearing anything, so can somebody confirm you can hear me?
We can hear you.
Thank you. All right, should be seeing my screen now. Not much to see, but there we go. So today we're going to talk about chapter 7. And after the lecture in the lab today, I'm going to give a review of the final. Let me state the final will be Wednesday, March 20th. You must complete it by 11:59 p.m. It'll have heavy coverage of chapter 7, chapter 13, chapter 14, and lab module 9. Any questions about any of that?
I have a quick question. If we aren't able to make the live session of the final review today, is it going to be recorded so that we can view it later?
Yes.
Okay, thank you.
And I never made it for the 3 p.m. lab, so what I'm going to do is simply make a copy of it and put it both at the 3 p.m. and the 7 p.m. time. All right, any questions about what we're doing? All right, let me get started. Chapter 7, the control of microbial growth. This is a topic that students generally have some familiarity with. So it's a topic that I end the class with, because students find this topic, I don't know, easy or easier maybe. Controlling microbial growth, we'll largely be talking about disinfectants and antiseptics, but we will talk about other ways to control microbial growth as well. Of course, know the terms of this lab. That's always important. Not quite as important as in chapter 14, where if you learn the term, you learn 50% of that chapter, but they are important in this term, this chapter too. Most people know what sterilization, disinfection, antisepsis are. Two, be able to discuss the factors that influence microbial death rates. Three, be able to discuss the three main ways in which antimicrobial agents kill or inhibit cells. Four, understand the various types of disinfectants and how they work. We'll only talk about that a little bit. And then five, understand the relative resistance of the major microbial groups to antimicrobial agents. And if we finish this lecture, we'll talk about number 5. If we don't finish it, well, we won't cover number 5 because it's discussed at the end of the lesson. And hopefully we'll cover it because otherwise I'll have to change the final. Any questions about what we're going to cover? Okay, when we're talking about microbial death rate, when we diagram the death rate, if we use a semi-log plot, meaning log on the y scale, regular arithmetic scale on the x-axis being time, the number of microbial survivals, we'll see that populations die in a constant logarithmic rate, meaning a linear relationship, when they're heated or treated with antimicrobial chemicals. So if at 0 minute we first expose the cells to the agent, if we have a million cells, after 1 minute, we'll only have 100,000 cells, as 900,000 cells have died. After 2 minutes, we'll only have 10,000 cells remaining. After 3 minutes, only 1,000 cells. After 4 minutes, 100 cells. After 5 minutes, 10 cells. After 6 minutes, only 1 cell surviving. So the deaths are having a constant die rate. And the important thing is that if you have lots of cells, you need more time to expose the cells to the antimicrobial agent. But that doesn't work when you use an arithmetic scale where the dying happens like that. But if you use a log scale, it's a constant death rate. Any question about any of that? All right, when we're discussing the microbial death rate, the effectiveness of the treatment depends on one, the number of microbes present. The more microbes are present, the longer the treatment must be to get an effective kill rate or effective treatment. Let's just say effective treatment. Environmental influences can affect the microbial death rate. The presence of organic matter may inhibit the antimicrobial agent. Like bleach, for example, is easily inactivated by organic matter. This is important because hospital specimens, whenever we're talking about microbes, there's usually a lot of organic matter around. Like if you're using bleach to clean up a fecal smear, you have to use lots of it because the smear will inactivate the bleach, the organic matter. The temperature of the treatment can affect the microbial death rate. Generally, the warmer the treatment, the greater the microbial death rate. The presence of biofilms can affect the death rate. Generally, if there is a biofilm present, the death rate will be greatly decreased if there is no biofilm. Any question about any of that? All right, the time of exposure is of course critical. The more cells you have, the longer time of exposure you need. You also need a longer time of exposure if you're dealing with endospores. Some treatments do not kill endospores. I'm trying to remember one. Well, like if you're treating the bacteria with alcohol, alcohol will not kill the endospores, so they will survive. There are some treatments that do kill endospores, like hydrogen peroxide, for example, but there aren't very many. And for those that do kill cells, you do need a longer exposure time to kill the endospores than you do to kill the vegetative cells. Any question about any of that? And then lastly, there are microbial characteristics of certain species that affect the microbial death rate. And I'll talk about this at the end of this lesson, but there are different things. Obviously, one is members of Bacillus and Clostridium create endospores, so that's going to affect the death rate. Then there's things like the Mycobacterium. They've got a cell wall composed of mycolic acid. If the antimicrobial agent is water soluble, that cell wall will definitely affect the death rates. Any question about any of that? All right, this slide is showing you the terminology of microbial control. I think you've had a lot of these terms in the worksheet for this chapter, so I'm not going to go over them, and they should be familiar to you. Sterilization, destruction of all forms of microbial life, with the possible exception of prions. But it does kill, if you sterilize something, you do kill the endospores. Some terminology: biocide, a germicide, a substance that kills microbes. It does not usually kill an endospore. So most germicides do not kill endospores. You only have a few treatments, like I stated, that kill endospores. One such treatment is hydrogen peroxide. Bactericide, that's a treatment that kills bacteria. Fungicides, a treatment that kills fungi. Viricides, a treatment that inactivates viruses. Any question about any of those? So biocide, the treatment kills the microbe. Bacteriostatic agent, on the other hand, doesn't kill the agent. It simply inhibits its growth. And then when you remove the bacteriostatic agent, if the cells are still alive, the cells will grow. We talked about this with antibiotics. You can have an biocidal antibiotic, or you can have a bacteriostatic antibiotic. And biocidal means it'll kill the microbes. Biostatic means it just inhibits their growth. And once you remove the antibiotics, the cells can continue to grow. A biostatic antibiotic works in that it's relying on the host immune system to remove the microbes from the host. Any question about any of that? Okay, sepsis refers to microbial contamination. Asepsis is the absence of contamination by unwanted organisms. You learned aseptic technique in microbiology. It is an important technique in surgery to minimize contamination from the surgical environment, such as the blade, the doctors, the air even. Any question about any of that? All right, let's move on to actions of microbial control agents. Antimicrobial agents kill or inhibit cells by doing one of three things. They can alter the membrane permeability. If you damage the plasma membrane by either the lipids or the proteins, you can cause the cellular contents to escape from the cell and thereby cause the cell to kill. That's that antibiotic called polymyxin B. Damages the cell by damaging the cell membrane. Alcohol can also damage the cell membrane. I can't think of another agent that does. Obviously, soap could dissolve the cell membrane, but the second way that antimicrobial agents can damage or kill cells is to damage intracellular proteins. If you denature proteins, particularly the enzymes, you can cause the cell to die. This is actually one way that alcohol does kill cells. It denatures proteins. Of course, alcohol also damages the cell membrane. Tetracycline is an antibiotic that damages proteins. The third way you can kill cells is by damaging their nucleic acids. When you damage the nucleic acid, you usually get mutations, and if you get enough of them, you will kill the cell. So if you damage the nucleic acid, you often have cell death. Any questions about any of that? An agent that damages nucleic acid is ionizing radiation. UV radiation also damages nucleic acid. Any question about any of that? All right, let's talk about the physical methods for controlling microbes. And these are physical agents we use to control microbes. You can heat the microbes, filter them, apply low temperature, apply high pressure, desiccate the cells or what to kill the cells, and that's using osmotic pressure. And you can use radiation as the last physical method to kill cells. Any question about any of that? Oops, went too far. Okay, let's talk about heat. All methods of heat kills microorganisms by denaturing proteins and enzymes. However, at extreme heat, like flaming and incineration, turns the cell into char. There are two types of heat: wet heat, involving boiling, autoclaving, or applying steam, and then dry heat. And that would be baking, flaming, or incineration. Flaming and incineration being much higher temperatures than baking. Any question about any of that? So moist heat denatures proteins and enzymes. Boiling at 100 degrees C or flowing steam kills all vegetative pathogens. It kills most viruses, fungi, and fungal spores within about 10 minutes. Often it kills the cells much sooner. Like E. coli, all you need to do is bring it to a boiling temperature and the E. coli cells are dead. Any question about any of that? Boiling and some viruses take much longer to destroy. Some endospores can survive greater than 20 hours in boiling water. Any question about that? Endospores are something that are very difficult to kill, if you don't recall. And I think it's the naked viruses which are resistant to boiling. So for reliable sterilization by moist heat, what do? We put the agent in a autoclave. And that's how we sterilize things in the microbiology lab, using an autoclave. An autoclave is putting steam under pressure, much like a pressure cooker. It's very effective, killing even endospores. So 1 liter at 15 minutes at 15 pounds per square inch. That's the standard operating pressure for an autoclave. At 121 degrees kills all endospores. It's the increased pressure that raises the boiling point of water so that much higher temperatures can be achieved. You could change the time. I've never seen an autoclave operate at a different pressure, 15 pounds per square inch, although I imagine it's possible you could, but I've never seen it. And then usually they use 121 degrees Celsius because that's the temperature that water boils at 15 pounds per square inch. You could sterilize the surface by applying steam directly to it, but that would only sterilize the surface. Any question about any of that? All right, let's move on to pasteurization. This is a process that Louis Pasteur came up with to reduce the number of spoilage organisms. It does kill the pathogens, but it does not kill all the microbes in the agent that you're pasteurizing. If you want to know, Louis Pasteur invented pasteurization because the beer and the wine industry came to him and they said, why is our alcohol spoiling? And he studied it and found out that if you apply mild heat sufficient to kill the agents causing the spoilage, but not high enough to damage the product, meaning some evaporation of the alcohol occurs, but not all of it. It denatures the proteins and enzymes of the cells, killing the pathogens and the organisms causing the beer and the wine, or in the case when we're using milk, the milk to spoil. However, thermoduric organisms are heat resistant and they survive. So when you have pasteurized milk, there are microbes in it. Pasteurization does reduce their number, but the pasteurized milk does have a shelf life because it does not sterilize the milk. There are microbes in the milk, and they will grow and eventually spoil the milk. Pasteurization is done in one of two ways. You can apply 63 degrees Celsius heat for 30 minutes, or you can apply 72 degrees 72 degrees Celsius heat for 15 seconds. Most milk today is using the second, 72 degrees Celsius for 15 seconds. Any question about any of that? You can also sterilize milk by heating it to 140 degrees Celsius for about 1 second. This is called ultra high temperature, or UHT milk. This milk does not require refrigeration because it does not have microbes in it. It is sterilized. It is not pasteurized. It is ultra high temperature sterilized. Any question about any of that? Okay, this kitty is showing you that dry heat is not as effective at killing microbes as wet heat, meaning you can have the cat climb into the oven and the cat's just enjoying the warmth of the oven, and then it'll climb out. And you all know this because when we cook something, bake something in the oven, we stick our hands in, pull out what we're cooking. So for limited times, we can be exposed to baking temperature. You put your hand in steam, it will immediately burn you. You cannot put your hand in steam. Any question about any of that? So baking kills by oxidation. Flaming incineration, it does kill by oxidation, but in reality, it turns the cell into char. Hot air sterilization is most often called baking, at least in this country. And the items are placed in an oven at 170 degrees Celsius for at least 2 hours to achieve sterilization. Now, if you remember, wet heat, we're putting it at 100 degrees Celsius and we're applying it only for 10 minutes. Any question about any of that? All right. Filtration is sterilizing a liquid or a gas by passing the solution that we're sterilizing through a filter that allows the liquid or the gas to pass through the pore, but the pore traps the cells so that down below the liquid is sterile, or the gas would be sterile. It obviously cannot work on a solid, but it can work for gases and liquid. Useful for sterilizing liquids that be altered by heating. Some examples, some juices are filtered, so they're sterilized by filtered. Coors beer is filtered by sterilizing. I forgot to mention that most beer is sterilized, as well as most wine, sterilized by pasteurization, which doesn't really sterilize it, it just reduces the microbes. And then it's relying on the alcohol to keep the beer or the alcohol good. Some vaccines are sterilized by filtration. We usually do not filter milk. The proteins and the lipids in milk will clog the pore and then prevent the filtration. Any question about any of that? If anyone knows anything about Coors beer, it tastes a little different because it's not pasteurized. And I'm not a beer connoisseur. I don't even like beer, but my brother used to go out of state to buy Coors beer because that was the favorite of his, because Oregon would not allow beer to be sold unless it was pasteurized. It was an old health regulation, and Coors Beer lobbied the Oregon legislature, which is where he was living, and they finally changed it and allowed it that if beer is filtered or pasteurized, it could be sold in the state. Low temperature is another way that we can control microbial growth. Understand that low temperature may not kill the microbe. It may just put it in stasis. Refrigeration slows the metabolic rate of most microbes, making most microbes actually inactive. However, even though most microbes cannot reproduce or make a toxin, the psychotrophs can reproduce at refrigeration temperature, 0 to 7 degrees Celsius. And they do reproduce about 3 times per day, and they will reach numbers of greater than 2 million cells within about a week, which is why most food, when you have it in the refrigerator for over a week, it should be tossed out. And that's because the microbes growing in the refrigerator can spoil the food after about a week. Any question about any of that? Freezing stops metabolic activity. What it does is it freezes the cells. They cannot reproduce or be metabolically even active when they're frozen. Slow freezing, which is your home freezer, allows ice crystals to form, which kill some bacteria, but only about 50% of the cells, bacteria. And then the ice crystals kill all parasitic species. So all eukaryotes would be killed by the slow freezing. But like I said, of bacteria, about 50% of the cells will survive the slow freezing and then the thawing out. Quick freezing and liquid nitrogen does not kill bacteria cells. High pressure is another way we can apply something to control microbial growth. High pressure transfers the pressure evenly throughout a liquid, killing all vegetative bacteria cells. You should note that endospores are not killed by high pressure. A high pressure is sometimes used to preserve the color, the flavor, and the nutrient value of juices. So if you sterilize it or clean it, because you're not really removing the endospores, but everything else you're removing by high pressure, you could do that to juice, and then the vitamins and the color and the flavor will be unaltered. The other thing you could do with juice is instead of pasteurizing it or sterilizing it, is you could send it through a filter, which would sterilize it. Heating usually changes the color, the flavor, and the nutrient value. For example, vitamin C would be destroyed if you were to heat it, at least to boiling temperature. And this is a little joke. We have a little baby coal and a lump of mother coal, and there's the daddy, and he's been under a lot of pressure lately and has changed from coal to a diamond. Desiccation and osmotic pressure have been used by humans for probably millennia, if not longer, to control microbial growth. Even though people didn't know they were controlling microbes this way, this is how they were able to get certain foods to be preserved by desiccation and osmotic pressure. Desiccation is drying something, like you can dry fruit or vegetables, dry it out, and then they will be preserved. It prevents microbial metabolism. Cells can remain viable for years, particularly if they are endospores. The mycobacterium can be viable for months. The resistance to desiccation varies by species. But E. coli, if you dry it out, E. coli would quickly die. I don't know how long, but certainly within a week, maybe even within a day. I don't know how quickly E. coli would die, but it's fairly quickly compared to, like I said, mycobacterium. Some of the cells could survive for months. And then endospores, well, you keep them a year, and most of the endospores will still be alive. Some examples of desiccation, like I said, dried figs, dried fruit, dried vegetables. Osmotic pressure can also be used in the same way. High osmotic pressure, either high salt or high sugar, causes plasmolysis, where the water will flow out of the cell. And so the cell membrane will pull away from the cell wall, and that's plasmolysis. And that will lead most cells to death. Like E. coli cannot survive that. And within a day, E. coli would definitely be dead by plasmolysis. Some examples of osmotic pressure being used to preserve the food. Why molasses and honey can stay at room temperature for years. My mother had a bottle of molasses that we figured was at least 20 years old. And then I took it and made molasses candy for my father, and he ate it and he enjoyed it. Okay, that was the last time that bottle of molasses was used. After about 30 years, my mother finally decided to throw the molasses away. Any question about any of that? All right. The last physical method for controlling microbial growth is radiation. Radiation damages DNA. Ionizing radiation is a form of radiation that has high energy, like X-rays, gamma rays, or electron beams. They have a short wavelength. And when they hit a molecule, they create ions, meaning they will hit an electron, the electron will absorb that energy, and that will throw the electron out of orbit from the atom or the molecule, creating an ion. The ion then can react with other molecules like DNA, and eventually the other molecules, if it's made into an ion, will react to DNA, and that will mutate and eventually kill the cell. Ionizing radiation is sometimes used for sterilizing food, pharmaceuticals, or medical supplies. Most food, if you see it in the grocery store, if it's packaged and sealed, and it's just sitting on the shelf at room temperature, it's probably been ionized. There are a few things like ultra high temperature milk you can find in the store, but most of them are sealed and exposed to ionizing radiation and then sold that way. Pharmaceuticals and medical supplies often use radiation to sterilize those too. Okay, any question about any of that? Non-ionizing radiation is a radiation that doesn't have high energy. The most lethal one is ultraviolet light. Ultraviolet light is one of the forms of non-ionizing radiation. It causes thymine dimers to occur. So two thymines that are next to each other, if they're exposed to ultraviolet light, they form a dimer between the thymines. And then those thymines do not bind to their corresponding the base, the A, and that creates a bubble in this DNA. This DNA is mutated because it cannot be transcribed and it cannot be replicated. I should warn you that non-ionizing radiation also involves visible light, microwaves, and maybe heat. All of these do not directly cause damage to DNA and then kill cells. microwaves in particular are not very antimicrobial, but microwaves do generate heat. And because of that, microwaves can kill cells by the heat. And then, of course, heat can also kill cells. Any question about any of that? All right, this table is showing you a summary of the different ways to control microbes. I'm not going to talk about it because we've already talked about each of them. You can review it as you like. Let's move on to the chemical methods of controlling microbes. There are a few agents, chemical agents, that achieve sterility. Most decrease microbial numbers to safe levels or remove vegetative forms of the pathogen from an object. Like when you use bleach on your toilet, you may not kill all endospores. Some endospores survive the treatment with bleach, but the bleach will kill all vegetative pathogens. And bleach is obviously a chemical agent we use for disinfecting, in this case, the toilet. Any question about any of that? So disinfection refers to the destruction of vegetative pathogens. The factors related to effective disinfection are the concentration of the disinfectant. Usually speaking, the higher the concentration, the more effective it is. The time, generally speaking, almost always speaking, the greater the time, the greater the killing. The pH also affects the disinfection. Generally speaking, the more acidic the treatment, the more effective the disinfection. Although for many agents, the more alkaline, it'll also kill more cells, but not all are that way. And then obviously the worst would be neutral pH. And then the presence of organic matter can affect the disinfection. Generally, if organic matter is around, the less disinfection there will be. Any question about any of that? All right, there are different types of disinfectants. We're only going to talk a little bit about them. Phenol and phenolics were the first disinfectants that Joseph Lister used when he was applying phenol to his patients or to his surgical instruments to get sterilized antiseptic surgery. He was actually using phenol, which is not a good agent to use because it's kind of irritating to the skin. He didn't know this, but it also causes cancer, and it has a disagreeable odor. Oh, and then it's corrosive to metals, and he was using it on his medical surgical blades. But it was the best disinfectant agent he found back then, and that's why he used it. Halogens, let me talk a little bit about them. There are two very common halogens, and I'm sure you're aware of both of them. Bleach is a halogen, and it is usually used to disinfect objects, like we use bleach to disinfect our toilets. Obviously, if it's used on living tissue, which it usually is not, it is an antiseptic. And the reason why it's usually not lived on living tissue is bleach is fairly caustic on living tissue. But it used to be, if it still isn't, one of the treatments of choice for necrotizing fasciitis. You would wrap the wrapping in bleach and then wrap it around the individual who had necrotizing fasciitis. And that was one of the effective treatments for treating the bacteria causing necrotizing fasciitis. That's the flesh-eating bacteria, if you don't know. And then another halogen is iodine. Tincture of iodine is in most houses. It is a very good antiseptic. It was so good that it used to be used all the time in hospitals before surgery because it wasn't toxic to skin. You could apply it. It had a color for where it was, so you knew where it was. You've applied the iodine, and then you could leave it on for long periods of time. And obviously, the longer it is, the greater cell killing you have. The longer, the greater the cell killing. It's no longer used in hospitals because they have better antiseptics. But like I said, it used to be used all the time. Alcohol is a very weak antiseptic or disinfectant. We usually use it as a degerming agent, like when we degerm the skins before we give a shot, we alcohol swab it, and that only reduces the microbes to safe level. It does not sterilize the skin, doesn't even get it that clean. Heavy metals are antimicrobial. Their use disappeared for a while because we had better agents to use, but because of the resistance of microbes to antibiotics, heavy metals have come back in medical treatment. Like they will often apply a heavy metal in gauze to prevent microbes from growing in a wound. Surface active agents called surfactants are things like soap and detergents that we use on surfaces to clean them, including our hands. Chemical food preservatives, we won't talk much about that, but you can add these to food to prevent them from spoiling. And I'm sure you're aware of some of them, like nitrites and nitrates are added to many different meat like bacon and sausages, hot dogs, to prevent them from spoiling easily. Doesn't mean they don't spoil, it's just they don't spoil as easily. Antibiotics, there are actually some antibiotics that we add to food, usually cheeses, and that's to prevent the wrong bacteria from growing in them. Aldehydes, gaseous chemosterilizers. Gaseous chemosterilizers are one of the few agents that do kill almost all agents, including endospores. The trouble with a gaseous chemosterilizer is they're highly toxic to us. I think it's ethylene oxide. Is that it? I'll have to look that up. I don't remember. They're highly toxic to us, and to kill endospores, you need long time exposure. Peroxygens, on the other hand, are oxidizing agents like hydrogen peroxide. They do kill endospores. So this is one of the few disinfectants which are very effective at killing microbes. Any question about any of that? All right. I'm not going to talk about these. This is just a summary of the different agents. Comparing the effectiveness of various antiseptics, soap and water. You can see that after 60 minutes of washing your hands in soap and water, you don't have 10% killing. You got a little less than 10% killing. You need about 100 seconds to get 10% killing. So soap and water is very weak antiseptic or disinfective agent. Soap and water are actually better. It's simply washing away debris and microbes rather than killing. A tincture of iodine is a fairly effective antiseptic where after 60 seconds, we have only, well, we killed about 80% of the cells. Only about 20% of the bacteria survive. And obviously, when you apply this, like when they did this to the skin before surgery, they would apply it and then it would sit there for a long period of time, much longer than 80 seconds, in which case the number of surviving would be 10% or less. Any question about any of that? All right, we're getting to the end of this lesson. Microbial characteristics and microbial control. This is a simple hierarchy of the relative resistance of major microbial groups to chemical biocides. The most resistant of all the microbes to any treatment is prion. It's very difficult to kill prions. Endospores are the next most resistant to treatment. They survive most treatment. Most antimicrobial agents do not kill endospores. There are only a few that do. Mycobacteria, the next most resistant. It has a bunch of mycolic acid in its cell wall that prevents any antimicrobial agent that is water soluble from getting inside the cell. The cystic protozoa, vegetative protozoa, the next most resistant. Gram-negative bacteria, the next most resistant. The gram-negative bacteria are a little more resistant than the gram-positive because all they have is a tough outer cell wall made of peptidoglycan. The gram-negative bacteria, I'm getting that reversed. The gram-negative bacteria are more resistant because they have an outer membrane around their cell wall that prevents some agents from getting inside the bacteria cell. The gram-positive cell wall does not have that. And as you recall, we mentioned that the gram-negative bacteria, their outer membrane, can keep penicillin G out of the cell wall so that the penicillin G cannot damage the cell. So penicillin G works on gram-positive, does not work on gram-negative. There are some detergents that cannot get through the outer membrane of the cell wall. And so the gram-negative cells tend to be more resistant than the gram-positive bacteria because the detergent can get right in the gram-positive bacteria and then damage the cell. Fungi, including most fungal spores, the next most resistant. Viruses without envelopes, the next most resistant. The naked viruses are more resistant than the viruses with the lipid envelope. Then the gram-positive bacteria, the second least resistant microbe, and then the most least resistant or the most sensitive microbe is actually viruses with lipids. If they have a lipid envelope, you can either damage the genome of the virus or the protein of the capsid of the virus, or you can damage the lipid envelope. That lipid envelope is sensitive and it actually dries out fairly quickly. If you consider a day on paper or cardboard, quickly. Any question about any of that? Now, this is a simple hierarchy. It's not looking at all factors. There sometimes are specific, what's the word? Not agents, but characteristics of some species which make it fall out of this category. And we'll talk a little bit about that. So biocides tend to be more effective against the gram-positive bacteria than the gram-negative bacteria. That's mostly because the gram-negative bacteria have an outer membrane which prevents the biocide from doing damage to the gram-negative bacteria. The mycobacteria also exhibit greater normal resistance to biocides because of the mycolic acid, keeping the biocide out of the cell. Viruses are not specifically resistant to biocides. However, there are distances that envelope viruses are more sensitive than the naked viruses. Prions are infectious proteins that cause spongiform encephalopathy. They are the most resistant of the microbial agents. To kill a prion, you actually need to bring the temperature up to about 1,000 degrees Fahrenheit. And nobody has quite explained why it's so difficult to kill a protein, because you should be able just to boil the protein and that would denature it. But apparently prions are a little bit different, and simply boiling the protein will not denature it, and the prion is still active until you get close to 1,000 degrees Fahrenheit, which will turn the protein into char. That will incinerate the protein. And that's one way to get rid of prions, is to incinerate it, like the British, when they were getting rid of their cattle, they incinerated all of them to get rid of the prion disease. How to completely kill prions is not completely solved yet, but one treatment that they do use when they're like operating on a prion infected patient is you can apply proteinases to your surgical instruments, and that will get rid of the prions. Proteinases dissolve the proteins, which will then get rid of the prions. Any question about any of that? How effective are prions? They buried prions in the soil for a year, and then they dug up the soil, and they found that there were still, most of the prions were still active in the soil. So prions are very difficult to kill. Any question about any of that? All right, let me go back here and say the mycobacteria have this mycolic acid in their cell wall, so they are resistant to most or any water-soluble agent. However, the mycobacteria are very sensitive to alcohol. Alcohol, which is a very weak germicide, it's not even really an antiseptic because it's so weak, is actually very effective at killing the mycobacteria. And that's because the alcohol can get right through the cell wall of the mycobacterium. Another thing is streptomycin is a lipid-soluble antibiotic, and it gets right through the cell wall of the mycobacterium. All right, so those are some of the characteristics of the different organisms that we've discussed. Any question about any of that? All right, while microbial control methods are effective, especially the biocides, they are not uniformly effective against all microbes. For example, bleach is a very widely available, very cheap, very effective antimicrobial agent, but it is easily inactivated by organic matter. And then bleach cannot kill some endospores. So some endospores of some species will resist killing by bleach. There are other endospores of some species that bleach does kill, but not all endospores are killed by bleach. And I don't know what the percentage is because I only know a few cells that make endospores. All right, the compounds discussed in this lecture are generally not useful in treating disease, with the exception of the antibiotics. For example, you may have recalled the President Trump, when he was president, said, geez, maybe we should give bleach to people to keep them from getting COVID-19. And that's not possible. You cannot give most of these agents to people. They would be too toxic. Okay. The exception is antibiotics, and antibiotics is specifically a drug which is not toxic to us and is specifically toxic to a microbe, and that's why we call it an antibiotic. Any question about any of that? Any questions about chapter 7? All right, if not, I'll have a review at 7, and I will see any of you who show up at that time.
Thank you.
All right.
you.
Thank you. Thank you.
Thank you.